The following segment is sponsored by Center for Sports Medicine.
Dr. Candace McKee joining us today. She's with Center for Sports Medicine and Orthopaedics. And Dr. McKee, oh my word, I know so many people that deal with neck and shoulder and back pain. So I really want you to home in on the use of injections to help prevent spine pain.
Yeah, spine pain can be tricky because number one, it can be from so many different causes, right? So there's all kinds of things to cause spine pain, neck pain, back pain, can be from any number of things, muscles, joints, aggravation of the nerves or the discs, that's supposed to be the cushions back there in the spine. So pain can get kind of tricky to manage and treat. We just from it being from so many different things, but we certainly have several options available for treatment and management of pain. And, we're talking about injections today, and big picture, injections are typically used as part of a comprehensive program to help with pain, meaning we're, typically use them alongside with things like physical therapy or a nice exercise program to, not only improve mobility and keep folks moving, but help with stability and strength and that sort of thing. But anytime we talk about doing injections around the spine or the joints, it can be a little nerve-wracking, but there are certainly lots of safety measures in place as well, right? So a lot of the injections we can talk about are always done under X-ray guidance as well. So all the injections that I do back there, we use an X-ray camera to see exactly where we're going. Not only, confirms the correct placement of an injection, but also kind of improves the safety profile as well. And injections in general too can be not only diagnostic and help us maybe figure out what's going on, but hopefully and optimistically will be therapeutic as well, meaning help folks regain their motion and have less pain and keep moving on with their life and doing what they want to do.
Sure.
Like we said, there's several targets back there when we talk about spine pain, and several different injections you can think about depending on, the individual patient and what's going on. Frequently, people have heard about epidural kind of injections, which is a kind of injection that can be done either really anywhere in the spine from the neck or the mid back or low back. And kind of classically, folks think about that when they're having, back pain, radiating leg pain, that sciatica kind of pain. And, when we talk about epidurals, that's usually, again, using an X-ray camera to see back there and injecting sort of a mix of some numbing medicine, some local anesthetic, as well as usually some anti-inflammatory things like steroids and that sort of thing. And besides epidurals, there's other kinds of injections like joint injections or facet joint injections, which is targeting the little joints between the bones and the spine, which can be a frequent cause of neck pain or back pain. And
Would you tend to go, all right, let's investigate this a little further, let's do physical therapy, and then start the injections? How does that normally work?
I'm pretty conservative, so usually the very first step is usually getting you in some physical therapy, maybe trying a little medication as well and seeing how that goes. And typically a next step may be considering an injection or maybe doing some more advanced imaging, an MRI or something. Again, just depending on what's going on. And kind of next steps may be thinking about an injection, especially for the right patient to either put off surgery or try to avoid it if we can altogether.
Sure. Center for Sports Medicine and Orthopedics. Here's the telephone number, 423-624-2696, 1-800-757-2696, and sportmed.com.